Let's talk about sleep medications. All right, so they're called depressants because we want you to be able to sleep. And some people can't sleep and have insomnia despite healthy sleep habits. So that's what we're going to talk about. Barbiturates, benzodiazepines, as well as some other medication that can help you sleep that may work, may not work. So you have to remember also that everybody's different. So just because one works for one person, it may not work for another person. So these are the stages of sleep. You are in stage 1 first, then you go to stage 2, stage 3, stage 4, and then you're in REM sleep, where they say you have most of your dreams. But if you wake up any time in between there, you always return to stage 1. Remember, sleep cycle is very important because that helps you heal. A lot of physiologic things are going on in your body to help you maintain health, circulation, etc. So if that gets disrupted, it can disrupt multiple parts of your body as well as just you feeling really tired. So insomnia is more common in female patients. As we get older, insomnia increases. And remember, insomnia can also is a lot of times due to outside environmental things such as family issues or girlfriend, boyfriend issues, whatever, you name it, work issues, just a lot of stress. We have a lot of stress. So there's ways to maintain it or try to improve it non-pharmacologically, like don't look at your cell phone or anything with blue light before you go to bed. Think of your room, no TVs, no electronics, which I know a lot of people don't do. They have their phones right next to them, including me. But that can actually increase your hormones in your body that helps you keep you up if you're exposed to that. So if you're fine going to sleep, then you shouldn't have a problem. But some people do have um, a harder time. So those are just things that you should avoid. Making sure it's a dark room and you use your room only for sleep. Don't eat a large meal before sleep. So those are all things that you can do. So there's sedative hypnotics out there to help people to treat sleep disorders. There's barbiturates, benzodiazepines, and non-benzodiazepines. Side effects are pretty much all the same regardless. Some of these you can get dependent on. The benzodiazepines and the barbiturates, you definitely can get addicted and your body can get used to it. So then if you stop it, you cannot sleep at all. Some of them cause vivid dreams or nightmares. You can get tolerance to the drug to where it doesn't even work anymore, but yet your body needs it. It can cause some respiratory depression and depression in general. It can make you wake up feeling hungover, although some drugs are different than others. Barbiturates are things such as your Ambien, Lunesta, Rozarem, uh, things you see on TV for sleep. Any of those sleeping aids are barbiturates. So they're long intermediate, short, ultra short acting. So it just depends what it is. So if you're taking Ambien or Zolpidem's the generic name, it lasts about 4 hours. If you're taking the controlled release, it lasts longer than that. It's supposed to help you fall asleep and stay asleep. It should really be only used for short-term use to 2 weeks or less, just because of the tolerance of it. Your body can get used to it, and then you feel like you need it to sleep. This is an obvious. Don't take with alcohol, opioids, or other sedative hypnotics. It can decrease the effects if you're on warfarin, steroids, again, these tricyclic antidepressants, and quinidine, which is not really used too much anymore. Now we have benzodiazepines. Anything that has a PAM, a LAM, Pamalam, that is your benzodiazepines. So alprazolam, flurazepam, triazolam, astazolam, quazepam. There's also clonazepam. So any of those, think Valium. Valium is your diazepam. And then lorazepam, that's your Ativan. So sometimes people are prescribed that because they have anxiety and they have all these thoughts running through their head and they can't get to sleep. So sometimes you may try that. It interacts with the neurotransmitter GABA, and GABA is one of those things that are known to cause excitability or anxiety, helps you not go to sleep. So that's what this is for, insomnia and anxiety. But you have to be very careful with these, especially with elderly. elderly with the barbiturates and the benzodiazepine. So your assessment, you're obviously going to do a history on them. Do they have any issues? So it helps you determine what medication to put them on. Your nursing diagnosis, sleep deprivation. And then the planning, you'll get adequate sleep when you're taking the benzodiazepines. Also, I would do with planning is watch for tolerance to the medications, make sure it's really limited, as well as the dose should be the lowest. You always have the lowest dose for these. Observe the patient for any adverse reactions. And again, before you put them on a medication, or even if they are on a medication, you always want to do these non-pharmacological actions, just, so hopefully the lowest dose will work, or they'll be able to get into a nice sleep habit. There are some non-benzodiazepines as hypnotics. Zolpidem is one of them, and it works with inhibiting neurotransmitters, so it won't cause excitability. It'll help you sleep. Now, it says duration 6 to 8 hours. It's not. The Zolpidem's really 4 hours, and the controlled release is longer than that. It's like 8 hours. It's short term, less than 10 days for insomnia. This also falls under the barbiturate, though, really. Ambien can be like that. So you have to be careful when you're giving them to older adults because this is what you see, which I see that in the nursing homes quite a bit. And I have to say, in reality, they are given clonazepam quite a bit, Ativan, because they've been taking, a lot of these elderly people have been taking this stuff for years. So they're actually tolerating the drug, or they become agitated if they're not taking the drug. There's also melatonin. So Ramelteon is one, melatonin agonist, that's your Razorem, and it's first FDA-approved hypnotic. It's not classified as a controlled substance, although we still do put it under the barbiturate umbrella, but this is another option. You definitely don't want to give it to a baby, so I'm not quite sure why the baby's there. And melatonin is what you need. It helps you sleep. And we naturally make melatonin. That's why when you're looking at the blue lights, it actually decreases the melatonin. Some people can have a hard time going to sleep. And of course, there's the same adverse effects. So with these sedative hypnotics, non-benzodiazepines, which we just talked about those, the Zolpidem and the Razorem, that's Ramelteon, you want to make sure they have sleep issues in the beginning. What's it from? Is it from anxiety? So they more have anxiety, and you want them to stay asleep. You want to watch them for the same exact side effects. That's it.